Hello team, this is a brief training on our respiratory protection program. The goal of this training is to help you understand how, when, and why to wear a respirator or N95. These terms may be used interchangeably throughout this training. It is important for you to understand how to wear an N95 safely and to recognize situations when you should leave the respirator use area, or red zone, and remove your respirator. Receive a refresher on how to safely don and doff your respirator and where to find reminders and guides if you forget any of these steps. In our setting, there are limited times when you will have to use a respirator. These include when caring for a resident who has confirmed COVID-19 infection and is still in the red zone, when caring for a resident who has had close contact and is experiencing symptoms prior to confirmation of infection, and any time the local health department directs us to do so. You must also wear a respirator if you are performing an aerosol generating procedure. These kinds of procedures are limited in our setting where you are more likely to encounter CPAPs and nebulizers. An N95 mask removes 95% of very small particles from the air. When fitted and worn correctly, these respirators will protect you from viruses, bacteria, and any other potentially harmful particles. If a respirator is damaged or not properly fitted, you are at risk of inhaling the particles that the mask is intended to filter. To wear a respirator, you must complete a medical evaluation and be fit tested to make sure that you can safely wear one. Next, you will select an N95 mask and try it out to ensure that it fits well. The mask should be large enough to cover your nose and your chin. You must be clean shaven and not wearing any jewelry that might impact the seal of the respirator. After washing your hands, hold the respirator in your palm with the nose piece pointing towards your fingertips. Place the respirator over your face with the bottom under your chin and the nose piece facing up. Next, take the bottom strap of the respirator and position it behind your head under your ears. Then, take the top strap and position it over the top back of your head. Gently press the nose clip with both hands to mold the mask to the shape of your nose. You should always check the seal of your respirator before each use. This is an example of a positive pressure check. This is done by first placing both hands over your mask covering as much area as possible. Then take a quick breath in to make sure that it seals tightly to your face. Then place both hands over the mask again and gently exhale. You should not feel any air leakage. A common sign that there is air leakage is having your glasses fog up. If there is air leakage, readjust the nose piece and straps and try again. If you still have air leakage, try a new mask. You may need to try a different model if you are still unable to get a proper seal. The negative pressure check is generally done on N95s with valves. These types of N95s are not recommended for use in COVID-19 situations. If you are wearing one of these types of respirators, this is how you would perform a negative pressure check. Cover the filter on the front as much as possible with your hands and gently inhale. The facepiece should collapse against your face and you should not feel any air moving around the seal. After wearing your N95, the front of the respirator may be contaminated. Do not touch the front of your mask. Instead, remove the bottom strap of the respirator first. Then, remove the top strap and discard the respirator. If you are practicing extended use due to PPE shortages, place your respirator in a clean paper bag with your name on it instead of discarding it. If you are unsure of the policy in place, ask your nurse or administrator. There may be times when you need to leave the respirator use area, or red zone, during your shift. You should leave the area if you notice a change in your breathing resistance, if you need to adjust your respirator or wash your face, if you start feeling sick or having dizziness, nausea, weakness, breathing difficulty, coughing, sneezing, vomiting, fever, or chills. If you feel sick, safely remove your respirator and let your supervisor know immediately. It is important to use your N95 correctly to protect yourself and your residents. Remember to only use the respirator you have been fitted for and to check it for proper fit and any potential damage before use. You should not have any facial hair or jewelry that could impact the seal. If you begin to feel ill or have any other reason that necessitates taking off the respirator, leave the respirator use area or red zone immediately and take care of yourself. Notify your administrator if you need to be fitted for another kind of respirator. It is important to follow the procedures we have covered today when wearing a respirator. With all of the new information we have learned over the course of the pandemic, it can be difficult to remember everything. This is why there are helpful signs posted in the areas where PPE is used. Everyone needs reminders sometimes. If you would like to review these protocols at any time, they are located in the Respiratory Program binder at your community. Ask your administrator if you have any questions about the respiratory protection program.